The Mum Mumble podcast is sponsored by Wiggle. Have you heard about Wiggle? Wiggle is the island's first female sexual wellness store, taking our pleasures, desires, and sexual health very seriously. Founded by a wife and husband team who had a desire to deliver something better, Wiggle has one of the best selections of toys, lingerie, lubes, and other sexual wellness essentials from hand-picked brands like Bijou Indiscrets, Satisfyer, Lelo, and more. Visit www.wigglecy.com to learn more. Hello, I am Eleni and this is the Mum Mumble podcast, a podcast I created over 5 years ago to give women and mothers in Cyprus a platform to voice their experiences, their stories, their opinions, their knowledge, and their expertise. There are over 250 episodes available in both English and Greek on the platform if you're new here. So lots to listen to and learn from, including topics and discussions on feminism, politics, and culture, and of course, anything and everything that involves motherhood and our bodies. Today's guest is on the show to talk about our bodies, and more specifically, our pelvic floor. Anastasia Uvarova is a specialist in pelvic health. She's a physiotherapist, a clinical pilates instructor, and specialist in ante and post-natal recovery. And today, she's answering all the basic questions we need to ask if we want to maintain a healthy pelvic floor. Our conversation isn't limited to women and childbirth. We go into kids' pelvic floors, boys and girls. What you should expect from physiotherapy if you do decide to go. The difference between a tight and weak pelvic floor, and how a pelvic floor can affect your sex life. Very interesting conversation coming up. Now, on with the show. Anastasia, welcome.
Thank you. Good morning.
To the studio. Welcome to the podcast. It's been too long, I think. We've known each other for
a while.
For quite a long time. The other day, you sent me a message or something. I was like, oh my God, I need to get her on. We need to talk about the pelvic floor again. We did it once before with Claire. We had a lovely little conversation about what it is, but I want to go a bit kind of deeper, but also I need you to simplify some things for us.
Sure, I'll try my best.
Because I think you've realized as well that once something becomes a trend.
Yep.
Yeah? There's
it is becoming a trend, but very slowly.
Yeah, it's like there's this flood of information that you get, and I feel that oftentimes women have a hard time sort of like sifting through it knowing what is true and what is not, and also what applies to me as an individual.
Yes, that's right. Especially you get all this information from the internet, from the doctor, from the friends, from your mom, from everybody.
Yeah.
And then you get overwhelmed with this. And it's not only about information about a certain topic, it's about different stages of your life. It's about while you're young, before you have kids, before you plan kids, when you get pregnant, after you give birth, time during, postpartum, and then heading into menopause, postmenopause. So every time there is new information coming in relation to your pelvic health.
So we'll try and take it stage by stage, but also, as I said, we'll get down to some basics. So the first question that I have here is, why should I care about my pelvic floor? Why does it matter?
Your pelvic, let me just say what pelvic floor is.
Yeah, let's do that.
So the pelvic floor is the, let's say pelvis, it's the bony area in the middle of your body that connects your spine and then your legs come out of it. So this is your pelvis, and the pelvic floor is the a set of muscles and organs. Commonly, it's called muscles, but you can take everything together, that sits at the bottom of that bony pelvis.
Okay.
All right. And it provides us with major daily functions. So with us being able to go to the toilet in a controlled manner, for us to be able actually to walk and to exercise, so stabilizing our body kind of and helping it to move. For us, and by us, I don't mean only women.
Yeah.
I mean everybody. I mean men, kids, any human being. Our sexual function, our reproductive function, just our ability to function. So these basic functions that we actually don't pay attention until something goes wrong with them, it's all your pelvic floor. And whilst all is good, but if you start to have any issues, this is when you realize that maybe I should pay more attention to it and start taking care of it. So in order to preserve these functions throughout life, we need to start to think about pelvic floor, ideally in a younger age, but also any time, as soon as your awareness is there. When I say about the pelvic floor is better late than never, it truly applies to pelvic floor. Of course, it's better earlier than late, but late is also good.
All right. So let's take it age-wise, because I do have a question here about kids. Mm-hmm. So let's start it at a young age, at our kids' age. Is there anything that we have to notice? Is there anything that we have to be aware of? And also, is the pelvic floor of a boy different to the pelvic floor of a girl in pre-pubescent, let's say?
Right, good question. There is some anatomical differences, obviously, and it's the same as for male and female. So there is extra exit for the girls and not for the boys. However, when it comes to kids, boy or girl, what I always will say to the parents, watch your kids' toilet habits and actually ask them about their toileting habits, especially when you cannot watch it. What do I mean by that?
Okay, what do you mean? What should we ask?
Yeah, what do I mean by that? Let's start at home. Yeah, something that you can observe. See how often your child goes to the toilet. Do they wake up in the morning? Do they go to the toilet? Do they hold on? Kids, they like to hold on because they get distracted. Do you need to remind them to go? We're talking now about a little bit younger kids, right? Do they sit on the toilet for too long? Are they in pain when they try to poop or pee? Even listen to how they pee. Are they peeing and stopping? Or they need to go to the toilet and in 5 minutes they go again. This is something that you can observe at home, right? Now, when it comes to school, I cannot stress and emphasize this enough from my over 10 years experience, because I do ask people for their history of a child, like what happened in childhood when you were younger. So many kids, they hold in school.
I've heard that. Is that true?
That's true, and that can be very detrimental. We're talking about some irreversible conditions sometimes. Okay, I don't want to scare people, but sometimes it can really, really affect your future.
Why do kids do that?
It can be different factors. It can be just the arrangement, the psychological factor. The doors are not closing. Too much noise for them. Maybe they have been told that the public toilets are dirty and we should be very careful, and they're scared of going on the public toilet. So there can be different factors. So I always tell to the parents, you kind of, if you are not very comfortable with public toilets, for the sake of your kids, you have to overcome it, right? And be a little bit more chill about it. Yeah, take your precautions, clean up, spray some spray if necessary. It could be because they are not allowed to go when the urge occurs, and this is another thing.
That is so true. I've heard that so many times. The teacher won't let me go.
Yeah. And then the urge will disappear. The thing is, with our urge to go, for anyone, for kids and for adults, it comes. So we want to go, we want to pee, we want to go and poop. And then if we overhold it, it disappears. But it doesn't mean that, it can come again later. but constantly holding back the urge can reduce the sensitivity of the area of the rectum. I'm not going to dive deep now into that anatomy. Our ability to feel it again, let's put it that way.
Okay.
Especially for the kids when they're getting distracted with so many other things. And then they hold more. We're talking things about like constipation. We're talking about bladder that might be overstretched and so many other things.
Okay.
So for kids, it's mainly toileting habits.
Yeah.
And it can cause really pain. It can cause UTI in girls more, because boys, due to anatomy, they're a little bit more safe due to the length of their peeing canal. Okay?
Yeah. And also the fact that many times they don't have to sit on the toilet if they don't need to.
And one more thing, just to add about the kids, of course about the adults as well, but especially about the kids, when this can be kind of, tried and rectified, is do not ignore constipations in your kids. Do not ignore constipation. Just don't.
What constitutes constipation? Not going at all in one day, or not going at all in 3 days?
There is a kind of a debate about it. Some say in order one day, the most important thing, the child should go easily, without strain, without pain. And there is the poop scale.
Yeah.
It should be just nice, soft form sausage. If
Yeah.
they're constantly going with the little bits that are hard, we are talking about constipation. Of course, kids can be constipated and still go, but that's a bit more detailed, like it's overflow constipation sometimes can happen.
Okay.
It's more difficult.
Yeah. I like those poop charts where they show you the shape and color of the
Yes.
poop.
There is a name for it. It's out of my mind now. It's if you just Google poop chart, it will come up.
It'll come up.
Yeah.
You'll see. Now that when I said about sitting on the toilet, when it comes to boys, I've heard that it's better that they sit and pee and don't stand and pee. Is that a myth? Is there something behind that?
I honestly do not know in a sense of a scientific proof. Doesn't come into. I did course on kids, and they did not mention anything, although they were very, very detailed. I think it's just a plus for the boys that they can just stand and pee.
Yeah.
But for the peeing specifically, there is no major issue about that.
All right. Well, see, it's just information that your eye catches, and you're like, ooh, maybe I should get my boy to sit and pee. And then you're like, well, why? So, no, it's good to go over these things. Okay, let's move into the teenage period. Boys and girls, again, pelvic floor. What happens there?
What happens there, the most important thing, what happens with...
And also I was going to say you can be less intrusive as well. So they don't communicate as much. You can't check on them in the toilet.
I know.
I've tried asking my 14-year-old about his poo and happened. He just looks at me
what?
like, ew, go away. Yeah.
Yeah, the ew part, actually. Yeah, I talk to my kids about pooping and peeing and periods is like, no big deal.
No big deal.
Absolutely no big deal.
Yeah.
So what happens is teens, they grow at the speed of light, especially the certain, stages, they just grow very fast. And usually this growth happens quite fast through their bones. And the muscles are kind of catching up, they're still trying to get all that protein to form themselves. So this is why sometimes teens, they're tall and their hands are kind of longer, legs are longer, and they are skinny. Like the body
just looks awkward.
Awkward, yes. Yeah. Same with the pelvic floor. So it tries their hard to support, and this is when it's more in the girls, but can also occur in the boys. This first signs of stress incontinence can occur.
Okay.
Especially when the period comes. And again, boys are a little bit more safe due to the length of urethra. The urine just doesn't have the shortness like they do have in the girls to travel. It will take longer time, but boys still can get leaks. And then there is the whole sexual development part.
Yeah.
This is a good time, in my opinion, in the ideal world. You get some sex education now in schools, and you probably get some sex education from your parents to some degree. It's a good time also to mention to them that pelvic floor exists. There is these muscles that is good to take care of them. And, if you do a bit of squeeze and release, this is how your muscles work. just to put a little seed of information. Right now, they could not care less.
No, they don't. They probably don't even know it exists.
Unless they do have really troubles, where at that point you probably will take them to the doctor, to the pelvic floor physio. They will not care, but it will stay at the back of their mind when the time comes. They will have that information.
Okay. All right. So, well, let's move now into, let's move into childbirth.
Let's move there.
Let's move there. So I've given birth. You've given birth. I never heard anything about my pelvic floor. I had no idea. I just thought, a baby's going to come out from somewhere under there and I'll be fine.
Right.
So if a young woman who is thinking about getting pregnant or is pregnant right now, what would your advice be to them? Let's start there first and then go into we've already had kids, what goes on. So what would you recommend to a young woman who is heading into pregnancy and childbirth right now? What would you recommend before and what would you recommend after childbirth?
Okay. So if somebody is planning pregnancy or just at the early stages of pregnancy, it's just getting curious about body changes in pregnancy and start to get that information. I'm just telling you, in an ideal world, by the book, they would come for, and some women actually do, before they decide to get pregnant. I had clients like this.
Is that because it's recommended by the gynecologist or is it just something that they know?
This is something that they know.
Okay.
This is, let's say, they Googled it.
All right.
Plainly
Okay.
speaking,
All right.
okay? Information from internet. And I'm just going to sidestep from your question for a second here.
Okay.
And I believe that now, in the time of internet, it's... we have some access to information, so it's good to become more curious about your body and what's happening. And in the same time, you can get paralysis by analysis. There is so much incoming information, so it's good to find a person who can tell you. And it's not necessarily pelvic floor physio only. It can be your gynecologist. If you do ask some questions, they will gladly answer.
Okay.
Sometimes they will not give you information up front, but they will answer if you ask them, definitely. It can be a midwife. Even doulas, they know about these things. So just to receive this kind of information. So going back, what to do during pregnancy, after pregnancy. If you start to do basic thing, proper breathing like into the ribs, working your core, gently engaging your pelvic floor, squeezing it and your tummy during some exercises you do during the week, let's say 2-3 times a week. And you just teach your body doing this. Your brain will learn the movement, the breathing. You will be 3 steps ahead after birth. Because if a mother comes to me after birth with all this overwhelm that happens after birth, and I have to teach her and her body absolutely new skill, it will take longer.
Okay.
Plus, she will be most likely tired, overwhelmed with the whole experience and so on. And it's like, I just want to rest. Don't overload me with these things.
Yeah.
So you start in pregnancy to prepare for postpartum. And of course, usually these things like urinary leaks, you sneeze, oops, I peed myself, start occurring in pregnancy because your pelvic floor gets 2-3 times overload with a baby weight.
Yeah.
And if you already had a little bit predisposition, it will come up. So, and then you give birth and then you move into postpartum. My very bare minimum would be to recommend, ideally again, in ideal world, to come at least for 1 pelvic floor physiotherapy assessment. Again, to get your breathing right, to make sure you do your pelvic floor contraction, the Kegel. I'm doing Kegel inverted commas because these days it's not only about the Kegel, it's about the breathing, the tummy engagement together. It's not only just sit at the traffic light and squeeze. And sometimes once is enough.
How long after having a baby should or can a woman come and get a checkup?
Anytime, ASAP.
Oh, really?
Yes.
Okay.
As soon as the lochia, the bleeding, postpartum bleeding subsides, I'll tell them you can come.
Okay.
This is like the soonest. The latest, 3 decades later, it's also fine. Whenever you feel ready.
You said you described earlier, the heaviness that comes on the pelvic floor when you're pregnant. And my God, anyone who's been through it can remember that heavy feeling. I was going to say I had a huge problem with hemorrhoids.
Yep.
Where does that come from?
Well, hemorrhoids, these are hemorrhoidal tissues are the ones that sit at the area of your anus, the anal opening, inside and outside. And when they get overfilled with the blood, they stick out. And usually under the pressure, which is the baby, right? Plus, quite often what I see, and this is a common practice, women might get anemic, so they're prescribed iron. Iron will make you more constipated, so you have to strain more. Plus, the whole movement of your gut slows down during pregnancy.
Okay.
Because of all that hormonal overload, everything gets relaxed, including your internal organs. It's not only your ligaments, right? So this can cause constipation. So you strain, it can add to hemorrhoids.
Wow.
But yeah, also the pressure again. And in fact, we had recently a conversation with my pregnant girls from my Pilates classes, and I showed them a couple of positions and exercises they can do, which is usually positions where your bottom is higher than your heart, and you do a small fast contraction, so you stimulate the area around to reduce that pressure. So you go onto your elbows and your bottom is up in the air.
So it's like that bridge exercise that we do.
And no, it's not the bridge. It's when you go on the 4-point kneeling, hands and knees, you drop onto your elbows, so your bottom is higher. I'm not fan of the bridge. The reason why I'm not fan of the bridge, you can do this for a few repetitions, but you end up on your back, and some women feel really dizzy on the back, immediately.
Especially when they're pregnant.
Yes.
And actually, it's recommended not to do.
You can do for some minutes, but I just don't do it because I get dizziness from my clients, so I don't.
Yeah. So what you've just described, I think, is the down dog in yoga, but you're on your elbows.
Yes, something like that.
All right. So bottom in the air. Mm-hmm. Okay. All right. So, because I mentioned the word yoga, and I'm not going to say that. I said to Anastasia before we put the microphones on, I said to her, I came across something interesting yesterday. It's called yoga pussy. Do you know what this is?
I don't know in that particular yoga pussy, but I'll tell you something, because I do also follow my colleagues and all things pelvic health on Instagram. The marketing is vast, there is an orgasm goddess and the yoni self-massage and what's not. All of this usually comes down to breathing, pelvic movements, and pelvic floor exercises.
Okay, I'm glad we cleared that up, because we did mention trends, but this does sound like a trend, doesn't it?
It's very catchy. It's very catchy, yes. And as soon as it helps women, I don't mind yoga pussy at all.
Okay, so does yoga help the pelvic floor?
Yes, yoga can help pelvic floor. If I would say it will be more effective if instructor that teaches yoga is also mentioning to the client about the pelvic floor and where they should engage. Same with me.
Okay.
I can have a Pilates class, right? And I have post-pregnancy recovery Pilates class. So when it's post-pregnancy recovery, my clients probably get fed up of me telling all the time, engage your pelvic floor, squeeze your anus, imagine you're holding the tampon, breathe into your side. So I always kind of go around the genitalia area when I give my cues.
Okay.
And same with the yoga. If you just go to normal class and you don't tell this to people, they might not know
think about it.
Yes.
Yeah.
It doesn't mean it will not work automatically. Through certain movements and breathing, our pelvic floor does work automatically most of the time. But if you want to target and go into that rehabilitation phase, you have to remind actively to do things initially.
Okay. All right. Okay, let's go back to childbirth, but let's take it from, I don't know, from someone my age, over 40, or even someone who's just finished, had her kids, and never looked at her pelvic floor, never considered. What should she be aware of? As in, let me rephrase the question. What would be the symptoms that an older woman would have to look into to think, oh, maybe something's going wrong with my pelvic floor?
Yeah, I just wanted to say about the symptoms.
Yeah.
Usually when you don't have symptoms, you don't have problems. It doesn't mean that they might not occur in the future, but most of my clients, 99%, come with the symptoms, and then few of them come without the symptoms for prevention.
Okay. So what are those symptoms that they normally come with?
Very simple, very first one symptom is they leak urine during the times when they don't want to leak urine. Nobody wants to leak urine.
Ever. No one ever wants to do
yes,
that.
In a situation they feel like they can't control it. It's like they couldn't make it to the toilet dry. They went for a walk. They sneezed once and suddenly they leaked. Another one is they started to have pain during sex.
Oh, really?
Yes. Pain with intercourse. It can be pain with intercourse. And I need to mention that it can be pain during or after orgasm, even without the penetration. Okay,
we've got a set. We're going to go into the sex part as well, because I want to talk about some sex toys and stuff like that as well. But so symptoms are normally leakage.
Leakage, yes. And we're talking about urine here. I do have, it can be air coming out of vagina during the times when they don't expect it and they don't want.
Okay.
It can also be fecal leaks. And this is even more of taboo than the urine leaks.
Okay.
If people they want, of course, to hide it and everything. When somebody leaks feces, it's even more devastating to them.
Wow.
Because of the smell, because it's not like you can use a pad.
Yeah.
Things can become more obvious.
Okay.
Things like that. Pain, simply pain on exercising, burning sensation, tightness sensation, some kind of itching that cannot be explained by anything else. They did all the tests on Earth and everything is fine. Yeah, so this kind
That's interesting. Itchiness.
Yes.
Really?
Yes.
From the pelvic floor?
Yes.
How does that work?
I would question either kind of neural impairment. Occasionally, it can be signs of some autoimmunity, like lichen sclerosis.
Okay.
Which can be triggered. Autoimmunity in women quite often is triggered after childbirth.
Wow.
Okay, so it can be somebody thyroid, somebody... it will be around their genitalia. They might feel like the area is irritated all the time, and the test coming back all the time negative. So it can be really frustrated. Usually it's a neural, and quite often goes with the tight pelvic floor together. Not always necessary, but
okay.
often.
All right. Well, you said tight. And I noticed yesterday that there is difference between weak and tight.
Yeah.
Neither of them are good.
Not really.
Okay, all right. So how do I know the difference? And first of all, what is a weak pelvic floor? What does a tight pelvic floor mean? And how do I know the difference?
I will now overload your brain even more and tell you that quite often...
It's 8:30 in the morning, so I'm ready for information overload. Give it to me.
Tight pelvic floor quite often will be weak pelvic floor.
Oh, really?
Yes. So I love to give this analogy, and because people are listening to us, not to use my hands and everything, imagine your arm, okay? Your elbow. So you bend your elbow, and you take your arm all the way to your shoulder, and then you stretch out your elbow all the way straight. Okay? So far. So this is a nice functional elbow. This is your nice functional pelvic floor. Okay? Now, if you bend your elbow and constantly walk around with your elbow bent, this is tight muscle holding your elbow. Okay? This is your tight pelvic floor. What can you do with that bent arm? Try to pick up a bag. That will be a little bit awkward, right? Picking up a bag with fully bent elbow. So it's not effective. It's weak.
Okay.
You cannot even lift something heavier because you need that force of straightening out your arm, picking up, and then bending. But you can't do that because it's tight. Okay, this is the best analogy I can give you in relation to tight and weak pelvic floor. Now, back to your question. Usually, weak pelvic floor will manifest as leaks.
Okay.
All right. At least it has reached certain weakness point where it starts to manifest as leaks. For some people, if I test them objectively, we'll talk about it in a bit, I would say they are on the weaker side, but they don't leak. So we do some preventative work and that's it. Tight pelvic floor, it in men and women both, usually can be felt around anus, like they really feel like there is some tension. Pooping might become challenging, and the same with the kids even.
Okay.
And also intercourse, especially for women. And inserting anything, tampon, speculum, it will be, very difficult for them. This can contribute to, not contribute, but this is how they will know that they have tight pelvic floor.
Okay. All right. So I realize that I have a weak or tight pelvic floor. I call you, I book an appointment.
Right.
What can I expect from physical therapy?
This is what I usually tell people over the phone, so they're not shocked to find out what happens. Do you want kind of breakdown to female, male, kids?
Let's go. Let's keep it with the female, and then we'll go backwards.
Yeah. All right. So you call me.
Yeah.
And you say you want a pelvic floor assessment, and I will usually tell you, let me give you a few explanations what will happen so you are ready for it. So what will happen is I will take a very detailed history. So sometimes we speak more actually than I check the person, especially if the case is complex. If it's just something quite common, which is I gave birth, I leak urine. Okay. So I take the history, then I do look at their general posture, how they stand, how they move. I will look around their stomach to see for abdominal separation, a gap in your abdominals, diastasis recti. Okay, this is like a standard postpartum checkup. And generally touch around the tummy. If they had cesarean section, I will check the scar as well, how it moves, does it hurt, how tight it is, and so on. And then there will be intravaginal check. So I will check the most effective way to know and check your pelvic floor muscles is through your vagina with a gloved finger. So I put my gloves on, I take plenty of gel, and I go inside and I check the muscles, and then I ask you to breathe and do a few contractions.
Okay.
Sometimes it might not happen because women are in pain for whatever reason. I can also look, sometimes I can just look. So I can undress you. And this happened to me many times. Somebody, especially who is in a lot of pain, I would not touch them. I will just look. Or I will just place my finger just at the entry of the vagina. I will not go inside. So we really work around the client. There is nothing you have to do.
Okay.
Right?
All right.
This is the standard, what's been done.
Okay.
According to your results, I'll give you some self-treatment techniques, maybe some self-massage exercises. And we proceed from there.
Okay. All right. With men?
With men, it's usually going to be, as I said, up to the point of a checkup. With men, rectal examination for the pelvic floor. Yes, rectal examination for pelvic floor, some external palpation, around the scrotum area. So it depends where they have the pain.
Okay.
Yeah.
I want to rewind back to when we talked about childbirth. I forgot to ask you about giving birth. I don't want to really say naturally. I don't like
vaginal
that. Vaginally, or having the C-section. Yeah. Is that different?
From the sense of rehabilitation?
Yeah, and also, damage as well. I mean, is there more? Because we know that Cyprus has such a high percentage of C-sections, and that there are women who actually prefer to do a C-section rather than a vaginal birth.
I'll tell you something. There is my experience, and there is also research. I will quote this research, which is a quite big research. Is they tested women on a pelvic organ prolapse. So this is when your organs drop down lower than they're supposed to be, and this can cause a variety of symptoms between women who gave vaginal birth and the cesarean section. Initially, women with vaginal birth, first few years, are at a higher risk. As the time proceeds, it evens out and the C-section goes a little bit even over. Okay, so in my experience, both women experience leaks.
Okay.
Whether it's vaginal or C-section. Okay, so the pelvic floor is affected by pregnancy, first and foremost.
Wow.
9 months.
So it's not the actual action of giving birth and pushing and...
It does have certain extent, but first and foremost, if you are pregnant, carrying to term, your pelvic floor is already affected. Now, there is a set of problems when you have pelvic floor injury. There is a set of problems when you have a major abdominal operation with a big scar, and it can get infected, it can get tight. I had women with a lot of pain. I had women with a lot of pain during sex, and they never gave birth vaginally. All their births were C births. Okay, so honestly, there is no easy way out. They're just not. And you will preserve your lady parts is just a myth that, serves the system that wants to...
wants you to have a tight pussy.
Yes. Well, I'll tell you something that what will give you a tight pussy really is you doing your Kegels regularly, like brushing your teeth. This is your best bet. This is your best bet.
You know, whenever I hear the word Kegels, I always, because I'm so old, I always go back to that Sex and the City episode where Samantha was telling, do you remember? Or did you not watch Sex and the City?
I never watched it.
It was the first time, I mean, like this was back in... like 1997, 1998, maybe.
I was born in 87.
And she was, okay, I was born in 81. But yeah, anyway, so you were 10. So Sex and the City was not appropriate for you. But yeah, she said, I'm doing my Kegel exercises right now while they were in a bar drinking. And the others were like, what? What are you doing? All you do is just tighten and then release, tighten and release. So is that all it is?
It was back in the days.
Then, yeah.
Yes, and now...
what's changed?
What's changed is it's not very functional because when you just sit there, like I could sit here and do my Kegels, squeeze and release. Listen, it's better than nothing. It is, for sure. But we need to take into consideration, do you have tight pelvic floor? Which area of your pelvic floor is weaker? Is it a little bit more in front? Is it more at the back? There is no breathing involved. And breathing, diaphragm, it's proven by, it's science now. Diaphragm works together with the pelvic floor. And this is when I check my clients, I don't ask them to squeeze nothing. I just ask them to take nice deep breath. And I need to see how much their pelvic floor moves along with the diaphragm.
Okay.
Is it completely stuck or is it moving along with the diaphragm? Okay, there is movement added. We are not sitting there and squeezing. Our pelvic floor needs to work when we run, when we jump, when we bend, when we go upstairs. Okay, so it's a little bit it's a bit old school, but if you have a generally healthy pelvic floor, why not to do some squeezes and just strengthen your chakras?
Yes, those chakras. Okay, let's move in. Well, first, no, you said breathing.
Yeah.
Is it just normal deep breaths or is there a specific technique?
Yes, there is a specific technique. There is a lot of belly breathing going around when it comes to post-pregnancy recovery. Belly breathing is good, let's say after a C-section, to relax the area. But many people, because of our lifestyle, because we sit, because we drive, they underutilize the diaphragm muscle. So the breathing usually goes at the bottom side of your ribs and especially at the back of the ribs. This area in 85% of my clients, unless they like exercise and do pilates, yoga type of, even not gym, it's underutilized.
Wow.
So they all breathing with their upper part front a lot and not with the side and the back. And this is like where you really diaphragm sits. You need to use, the diaphragm is a big dome. Okay, if you Google picture of diaphragm, you will see. So only a few parts of this dome is utilized by most of the people. And this is why breathing is so important. And this is why I dwell on it. And this is why people find it so hard, whilst I give them seemingly very easy exercises.
Yeah. All you're telling me is to just breathe. But then again, try doing it for, I don't know, like maybe even 2-3 minutes. And it's actually quite hard for some people.
It is. And people get frustrated and say, don't worry, this is a new skill for you, a new skill for your body. You have to learn it. I'm not expecting you to do it from the first time.
Yeah.
And I give them different cues, different ways how they can help themselves, and they just learn it.
Okay. All right. We've left the best for last. Sex. You mentioned earlier how it can affect, how it can be painful. Is sex good for the pelvic floor?
Sex is good for pelvic floor as soon as it doesn't hurt.
Okay.
Because it's the action of sex, and it doesn't have necessarily to be the classic penetrative sex. Anything that stimulates the organs, the area, stimulates the blood flow. There's usually movement happening. So positive sensory input. As soon as it doesn't hurt, it's good. Okay? Whether it's sex with your partner, non-penetrative sex, or sex with a toy, is good for the pelvic floor.
Okay.
As soon as it doesn't cause pain.
Okay. So sex toys. There's like
plenty.
Many. Many. Are there any specific ones that you would recommend to someone who is in pain and needs the stimulation and can find it another way?
I love this question because I have done stories on the sex toys in my Instagram.
I've seen them.
It usually gets me comments and comments.
I haven't noticed the comments.
No, DMs. People send me, people will not comment openly.
All right, okay.
People will send me a lot of DMs.
I thought, are people going that batshit crazy? They're sending comments on sex toys.
They send me a lot of DMs.
Okay, and what are the questions that they normally ask?
Some of them are just... I had all the spectrum of reactions. I had from people saying, what are you doing? Don't do that. Don't you feel ashamed? To ha 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 ha. So various reactions. It's all good. It's all fine. You just have to educate a little bit people about that. So I do use, not that I do use sex toys. So what I do is usually when somebody has painful sex, or they probably gave birth recently and they want to go back to it. I will ask people, do you owe a sex toy?
Okay.
All right. And believe me or not, about 7 out of 10 will tell me they have a sex toy. Yes, they use they owe a vibrator.
Wow.
I do use vibrators in order to help women to overcome. I will also talk about dilators in a second.
Okay.
Let's stick to the sex toys. Smaller vibrators, or the actual vibration. So they can, first of all, do it at their own terms, at their own time, at their own speed. And they can also do like a bit of a massage with a toy. It can be massage of the scar that might have occurred after giving birth.
Okay.
Maybe they can just do a little bit of penetration and back off. Because when you do it with your partner, it's a little bit more stressful because there is a human in front of you. They might get also impatient, understandably. So you do it on your own terms. So I do use sex toys in that sense. And then there are specific tools that are called vaginal dilators. That are they look like little dildos, basically, not so little. They progressive in size and can start something small like a small finger, and then it can go to the full size. This can be used in the conditions like vaginismus, inability to have penetrative sex. They can be also used after giving birth in order to progress. And if they, let's say, use these and they have a vibrator, sometimes I have suggested clients to use a vibrator around the area or on the clitoris as a distraction for penetration.
Ah, okay. So the actual dilator doesn't have a vibration?
No, dilator, no. It's just...
you just insert it?
It's just a plain, like a penis, loosely penis shape, silicone thing that you insert in order to expose yourself to penetration.
Okay.
All right? And some women find it intimidating. Sometimes they struggle, and sometimes it's good to have a bit of distraction, as a vibrating around the area.
Okay.
But generally, I'm all for sex toys. I'm advocate for them. And if it helps you, it's just you have to communicate this with your partner. And I think people need to understand that sex toys is not their enemy. It's their ally.
Do you feel that a lot of, I mean, obviously you're not a couple specialist, but I do hear this a lot, that there is a resistance towards sex toys because they kind of think that it's going to replace the real thing, or I'm going to like it so much that I'm never going to want to be with a man or a woman again.
I tell you, again, I'm not a couple specialist.
Yes.
All right.
Okay.
So this is a little bit more personal opinion and nothing else. This is not a scientific, although I think there is a science behind it, and it disproves this theory that if I use vibrator, then I'm not gonna. Let's say I have a boyfriend, all right, and I go and I have sex with him, and I have a vibrator along that helps me to have orgasm quicker, better. And then I have the same. And then I take the same vibrator. A few days later, I decide I want to masturbate, and I use the vibrator and I have orgasm. I will think that I had orgasm with my boyfriend back then, not with a sex toy. All right? So I will think about that was a great experience, and he was so open to it, and I had such a good time with him, and it was so great. And then, okay, I had my orgasm with the sex toy. Nice. Okay. Next, you know? So it's the feeling as soon as there is the communication. And of course, you know, both partners have to be comfortable. So you see where you start. Maybe you start with something very tiny and small, you know, and that's it. You don't have
non-scary.
Non-scary, yeah.
Well, I was going to say that I know that you know the sponsors of the show.
Yes.
Wiggle. Shout out to Wiggle.
Yeah.
Yay, we love Wiggle. We get so excited when we get little boxes from Wiggle.
Yes.
What do you have to say about something like Wiggle opening up female focus? That's what it says. It's a female focus wellness shop. What have you noticed? And do you have anything to recommend that you've tried in the range, the big range that they have?
Yeah, well, I have as I said, I have stories that are saved, and it's sex ed. It's called, and you can.
I'll put Anastasia's links in the show notes.
And you can check there. And I do use their products to demonstrate because they have great products there, and they have all the shapes and sizes, especially those little stick type of toys that women can use in order to either reintroduce the penetration or maybe as a management of her condition. So definitely lubrication.
The lubes are amazing.
The lubes, especially after birth. Guys, don't go stingy on lubes. Just lather them on. Especially with that. Honestly, I think they're not only they're also on male-focused wellness. I think that they're great for all the adults out there.
I was going to say, I did get a comment yesterday from a man saying, why is it female-focused? Is there not anything for us? And I was like, no, there is for you as well.
I checked, I explored their website a lot, and there is great products going on there. Also, little things like clitoral vibrators. I'm really advocating for them as well. And I did actually had clients who would come to me and say, like, everything is fine, everything is kind of okay, but I can't reach orgasm with my partner, or I never had one and I would like to try one. And I did actually educate people at different ways how orgasm can be achieved, because it can be orgasm through cervical stimulation, clitoral orgasm, perineal orgasm. So orgasms can be very different. And clitoral orgasm for women is a bit of a highway. It's like, boop, it's the easier. So just a bit of stimulation, and these toys usually are very small and non-intimidating, especially as a first timer. So all of these, they're great.
Yeah. There are actually very few things that are scary in the sex toy range that especially Wiggle has.
I think they all look so cute and colorful.
Exactly, just cute, and you can have them in. And I love the pastel colors as well that they have. It's just it's a joy to shop on there and then have some fun, for sure. So Anastasia, I will put your details and information in the show notes. But if anyone is listening right now, which ways do you prefer that they contact you? By phone, social media?
I'm quite active on social media, and usually I will respond quite quick on Instagram. So Alpha Physio Care, this is my Instagram. This is the fastest way, and then we can take on from there. You can call me as well, 22-3-22-408. I reside in Nicosia, and I see people here, but I also consult online quite a lot, internationally and across Cyprus. So if somebody has no possibility whatsoever to come to Nicosia, Yeah,
excellent. You know what? I just realized that we didn't talk about menopause.
We didn't
talk about menopause. Is there anything that you could just add on?
There is,
or is it a vast chapter that we should probably?
It's not a vast chapter. There are a few things I would like if you listen to us. The most important thing in menopause or before menopause is to start as soon as possible. It's similar with the pregnancy and after pregnancy, because when you are in a menopause, there is again such a hormonal turmoil going on. And I've seen this a lot from my clients. They're so overwhelmed. And then I'm overwhelming them even more with those pelvic floor exercises. So if you are approaching menopause, you may be perimenopausal, start now. Okay? And believe me, this is something 10 minutes a day of your time. That's it. I promise I will not overload you with very, vast things when it comes to menopause.
Yeah.
And then just create a habit. Make sure you created a habit again before you hit the menopause. And then it's just going to be there. This said, as I said before, it's better late than never. Even if you're postmenopausal right now, it's still, there are so many things you can do about your pelvic floor.
Okay. All right. Excellent. And thankfully that we are beginning to talk about this a bit more. There are events going on. I don't know when this will be coming out, but I'll be presenting an event on the 16th of March in Limassol. I'll be putting information on my social media if anyone wants to catch that. But there are professionals who can help you with your pre-menopause journey. So please look into that, find them. Don't just hop on another trend. Consult professionals.
I agree. Yes, and the trend.
Don't suffer in silence.
The trend is growing. I can see that the trend is growing in Cyprus.
It's good that we're talking about it. That there's awareness.
There is a menopausal dietitians, nutritionists, support organizations, coaches. It's brought up a lot, and I'm so happy about it.
Yeah, me too. We're moving things, and we're moving places, and that's good. Anyway, so thank you so much, Anastasia.
Thank you for having me.
For being with me this morning. I had a lovely time with you. Thank you.
Thank you.
It was interesting. Poo, pee, sex, pussies.
All the important things in life.
It was so good. It was so good. Thank you so much.
Thank you.
Bye.
Bye.